Daily cases in the second wave of the deadly Covid-19 pandemic may have retreated from their peak of over 4 lakh, but state administrations are not breathing a sigh of relief. If anything, they feel that there's no room for complacency this time around, and they intend to prepare for the worst. To that end, state governments, including those in Maharashtra and New Delhi, are putting special task forces together to plan for a third wave of the pandemic. Maharashtra's Health Minister Rajesh Tope was quoted as saying recently, quote, "We are setting up a pediatric task force immediately. We are not vaccinating those under 18, so we have to take more precautions for them. Children and infants need their mothers with them, so we need separate planning for them," unquote. The Maharashtra government intends to put a plan in place for the possible third wave of the virus based on the task force's recommendations. In New Delhi, Chief Minister Arvind Kejriwal said his government is preparing by ramping up infrastructure to deal with 30,000 daily cases. During the second wave, New Delhi reported a maximum of 28,000 cases on a daily basis, and the Chief Minister aims to be able to deal with a higher case count. However, he has gone on record to state that the ongoing vaccination drive must be accelerated.
अब हम जिस स्केल के ऊपर इंफ्रास्ट्रक्चर क्रिएट कर रहे हैं, हमें हफ्ते 10 दिन लग गए, लेकिन अब जिस स्केल के ऊपर हम कर रहे हैं, अगर अगली लहर में 30,000 केस भी आते हैं, तो हम उसको डील करने के लिए तैयार हैं.
Industry experts meanwhile feel that a lull in cases needs to be used to stockpile medical supplies to prepare in advance for a large outbreak like the second wave of the pandemic.
There has to be a stockpile because you can't, if there's ever a big outbreak like the one we've gone through in India, and I hope our wave 3 is not as ascendant as we've seen this wave to be, and as quickly ascendant as we've seen this wave to be. So I would expect some kind of a stockpile that exists either within various manufacturers or in a tie-up with the government to be able to respond to an immediate crisis while allowing the manufacturing industry time to scale up. So I would create some strategic stockpile of drugs if that's possible at all.
Vora also feels that vaccination efforts will need to be bolstered, and the very nature of the disease will likely require supplementary vaccines in the future.
There will be a very significant need and momentum to vaccinate as many people as we can. I think the traditional vaccines, which are the adeno vector-based vaccines, which we have in India, already there are so many tie-ups to increase capacity, and I think they will only increase. I think the disease is unfortunately shifting. So even, even if we get vaccinated, there will be a need as more variants multiply for us to keep getting vaccinated.
In what is likely to be a recognition of the need to prioritize vaccination for those in greater need, the central government has announced the deferment of vaccination for those who have contracted the virus for 3 months after recovery. This assumes that individuals who have beaten the virus have antibodies that will prevent reinfection at least for a time. Additionally, lactating mothers will be prioritized for vaccination going forward, and this is likely in anticipation that more children could be affected if the potential third wave does strike. The bottom line, though, is that there is no room for complacency. Alex Matthew, ET Now, Mumbai.